Hello, everyone. As Elizabeth said, this is number 4 of 5. When I conceived this series, I really didn't realize how well everything was going to be fitting together. But as it turns out, every one of these is built on the previous webinar. The genesis of this topic was that in COVID-19, last I heard, about 20% unemployment. A lot of people have lost their jobs. A lot of people are financially strapped. It's a tough time, and high medical bills and high deductibles and high copays are only going to make it worse. So next week it's going to be on what's next. And I'm really looking forward to that one. I mean, you won't believe how far out we're going, but then what the relevance is to what we're going through right now. But tonight, it's how to save dough on your medical as well as mental health care. So with that being said, let us begin. So this is who I'm talking to tonight. I'm talking to regular folk. If you don't want to be sick, if you don't want to go bankrupt from medical expenses, if you can't afford or obtain any health insurance, if your deductible is so high, you might as well not have it, and if you can't afford your meds. And basically everybody, if you are concerned about finding or affording good quality and affordable healthcare. I begin with this program with 2 caveats. Caveat 1. I love my allopathic colleagues. That's like MDs, DOs. They're good guys and gals. They have something called a confirmation bias. That is, they have been told it is this way, it is this way, it is this way, and that is the way they've learned it, and anything that is not this way and this way and this way is outside their field of reference. I am not blaming them for that. They are overworked, overwhelmed, underpaid, underappreciated, denigrated, and constantly stressed. They simply don't have time to learn principles of integrated medicine, which is what we're going to be talking about tonight, and hormone replacement therapy, which I will again be briefly touching on. And they are not reading the latest peer-reviewed literature because they don't have time to read it. An interesting concept is this notion of disintermediation and dematerialization. Disintermediation is where the middleman gets pulled out, and dematerialization, materialization, is where a entity, a healthcare clinic, a hospital goes away, but then what's going to take its place? It can be practitioners who are practicing this way on video, telemedicine, and they are no longer in a physical location. They have dematerialized, and that is now. So that's the first caveat. The second caveat is some of this material isn't easy and some is. I'll just ask you to do your best. I will be posting all of these on SlideShare so you can go through the slides easily, as slowly as you wish. Here were my 2 choices: make it easy or give it to you straight. And I decided to give it to you straight. None of the best things in life are easy. This isn't either. This program will challenge you a bit, but I think you're up to it. And it is also a really, really, really blunt presentation. All right. So speaking about blunt, I learned from Chandler and Litvin in their book, The Prosperous Coach, that one should show your clients what they cannot see and say to your clients what no one else will say. So I'm going to show you what you haven't been able to see yet, and I'm going to tell you things that nobody has dared to tell you before. So not doing it to be mean, ornery, problematic. I'm just doing it. If you want to save money, then you need to hear the hard, unvarnished truth, which is what I plan on telling you tonight. So let us begin with this. This is one way to look at the health continuum. On the one hand, you're optimal. On the other hand, you're dead. And then there's everything in between this. And it's a very interesting distribution. It is a bell curve where 2/3 are in the middle, and they are described as incompletely healthy. Some degree of mental or physical illness that keeps them from being completely healthy. Incompletely healthy, 2 out of 3. Next group is about 20%, 1 out of 5, who are described as completely unhealthy, having low levels of health with high levels of illness. These are the people that I sometimes see in Walmart that are unfortunately morbidly obese, and frequently not because of their fault, because just like doctors, they have their own confirmation bias and haven't learned things. But they're riding around in the wheel, the little electronic thing, and they're probably on a high blood pressure medication, a high lipid medication, a high sugar medicine, and it's just sad to watch them fade. But that's about 1 out of 5. And then about 1 out of 5 were completely healthy. Now, keep in mind, this is 2002. I think now it would be a little bit less, and more people would be incompletely healthy. But 20%, 19, were completely healthy, and they were functioning well. So when you look at the group that's incompletely healthy or completely unhealthy, that's 81% of the population. Only 1 out of 5 of us is really healthy. So here are some definitions of sick versus healthy. Modern medicine says, if you are not sick, then you must be well. In other words, if we can't diagnose you with high cholesterol, low thyroid, high lipids, high blood sugar, if you don't have any of that, then you are well. Well, maybe that's not right, because there are some other things that could be going on. This was the definition that the WHO, Donald Trump's favorite organization, said in 1946. They said, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. That's WHO in 1946. And this reminds me of a couple of things. One of my mentors, incredible psychopharmacologist named Stephen Stahl, once gave a lecture that I heard entitled, Why Settle for the Silver When You Can Go for the Gold? And he was talking about treating depression all the way to remission. And so my goal after that was all of my depressed patients would be remitted. They would be happy campers. And that actually fed into our tagline of integrating mind and body for peak performance. And so it's gone. Now, that 46? Yeah, 1946 definition didn't last in our modern 21st century. This is from British Medical Journal 2011. And they said the World Health Organization definition of health as complete well-being is, get this, no longer fit for purpose given the rise of chronic disease. Now, I grew up with the good old boys in Northeast Texas, and let me put this in good old boy to you. So they totally changed the concept of complete health to the ability to adapt and self-manage in the face of social, physical, and emotional challenges. In other words, since you're going to be sick anyway, learn to live with it and deal with it. That is the medical establishment's position in the 21st century, as reported in the British Medical Journal. So here's how to succeed in being incompletely healthy, and that is to fade slow. I'm sorry, that should be completely healthy. And the way to do it is how to succeed in being incompletely healthy, being in the bottom 81%. So don't watch your weight, eat whatever isn't nailed down, smoke your lungs out, booze it up, and whatever you do, don't exercise. Then be indifferent as your hormones drop and you get fatter, sarcopenic, which means you have a poverty of muscles, you lose your muscle, depressed, hypertensive, high cholesterol, high blood sugar, et cetera, et cetera. And then whatever you do, keep seeing your conventional practitioner and keep getting Band-Aid symptomatic treatment. And for heaven's sakes, make sure you get treated for depression if you're showing some symptoms of depression. That is how you succeed in being incompletely healthy. Let me continue. This report, Chronic Diseases in America, which was done in 2019 and published by the CDC, and which I accessed 3 days ago, looks at 6 in 10 adults in the U.S. have a chronic disease. 4 in 10 adults in the U.S. have 2 or more. And the total cost to the health system is $3.5 trillion. You say, well, I don't care about that because that's the government's paying that and the insurance is paying that. And what I care about is what's coming out of my pocket. So we'll show you that. Here are the fine points of this report. 100 million of us Americans had 1 or more chronic conditions in 2014. And by the way, for all my Canadian friends listening in, you're probably a lot better. It's a cleaner, healthier society than what we've got in the US, and I admire and respect you for it. These 100 million people that have 1 or more chronic conditions contribute 90% of the nation's healthcare cost. And this other citation notes chronic disease is a major contributor to healthcare costs owing to the need for disease management. Now, truly, do we need disease management? How about not having disease in the first place? And is that even possible? So in 2003, I was out in Las Vegas, Nevada. This is in McCarran International Airport. I had just gone through an amazing workup at Mismanaged Medical Institute. And I thought, when I looked at this, yeah, that's a classic car. If I had that car, I'd take really good care of it. And then I thought, well, I've got this body. I should really be taking care of that too. So if you had this car, would you really try driving at 100,000 miles without changing the oil? I mean, would you? I guess only if you hated it. So I decided to report to you integrative medicine and conventional medicine for cars. And you will never think the same way about labs again. And again, why can't we do this? Why can't we have a complete physical, mental, and social well-being? Well, because of the dichotomy between the integrative, what I'd like to consider the enlightened approach, and conventional practice, the way everybody is doing it. So if you're doing integrative medicine for your car, you use fuel additives that you can use to keep the cars burning cleaner and preserve engines. We use optimal quality of gas. Cheap gas causes pinging. We should take our car in for preventive maintenance before anything breaks. What a concept. Not because we're sick, but just because we want to stay well. We want the car to stay well. Conventional practice for cars is don't use fuel additives. They are unnatural. Gas is all that is required. And by the way, the quality of the gas is irrelevant. Anything that the motor will burn is adequate. And preventative maintenance, this is silly. Wait until something breaks, then take the car in for service. Integrative medicine, conventional medicine for cars. Now, you say, well, that's kind of stupid. That's not reality in terms of medical care for people. But is that really true? So let's look at what people put in to burn. So this was, I forget which trip I was on. I stopped, I saw the Red Bull pizza slice and this guy's big belly. And I thought, man, those two things go together. That is the American public right there, slurping down Red Bulls, taking in pizza and not exercising enough. And by the way, a guy with a belly like that probably has insulin resistance. So one of the things that we know is that as people age, and I know there's a lot here, I told you it wasn't going to be necessarily easy, but you're up to it. As people age, there are hormonal changes. Basically, as we age, our hormones go down. It's just a question of when they're going to go down and how much they're going to go down. And then Calabrese and his colleagues said deficiencies in multiple anabolic hormones have been shown to predict health status and longevity in older persons. Now, what does that mean? You say anabolic hormones. I thought those anabolic steroids were illegal. Well, some anabolic steroids are illegal, and they're illegal because athletes that have a poor sense of conscience and who weren't taught right by their mamas and daddies decided to cheat. But in terms of us humans, we have built-in anabolic hormones, and those are DHEA and testosterone, to name a couple of them. Also, growth hormone, which we hardly ever touch with our patients. And it's interesting to look at the difference between female menopause, which is abrupt and permanent cessation of ovarian function. That's one definition. The symptomatic definition is a woman who has had no periods for a year, and then whose follicle stimulating hormones over 50, the estradiol is less than 50, no periods in a year, she's menopausal. Male aging, however, does not result in similar symptoms. I mean, a woman, menopause, cannot get pregnant. A guy, 50, 60, 70, can still get women pregnant. In my previous career as a musician, I was a pianist. One of my idols was Franz Liszt. He was the swaggering Mick Jagger of classical music back in the early 18th century, 19th century. And he was fathering illegitimate children into his 70s. So guys can still be fertile, but they may not be optimally set in terms of their hormones. And I'll show you about that. So I like this citation because it says, look at what's on the slide. I'm going to tell you what it says. It says, women who have no previous history of depression can get depressed when they hit menopause. That's what it says. It doesn't say they're stressed and, psychologically agonizing about their life. No, it's biological. And here it is, transition to menopause and its changing hormonal milieu, that's a fancy word for what's going on around you, are strongly associated with new onset of depressive mood among women with no history of depression. Gee, do you think some of those women get stuck on antidepressants needlessly? This is in the Menopause Journal 2010 by Freeman. So when I look at labs, I look at what old lab reports used to say. This was printed on the lab report. It says, male and female reference ranges used for flagging are based on statistics for all female or male or female subjects tested. The age-specific guidelines in some cases show normal values for a given age to lie. Where? Outside the collective normal distribution for all ages combined. Now, what does that mean in real English? That means now, if you get copies of your labs by MyChart online or whatever, and you can see it, and you can see some of your levels are high or low, this says you can be perfectly normal and still have a high level and or still have a low level. Now, there are some low levels that you want. TSH is one of them. There's some higher levels that you want. Testosterone and estradiol and DHEA sulfate are some of those. But it doesn't necessarily mean that what's in the little parenthesis where it says normal, you got your value here, and then you've got normal. It means that you need to expand your paradigm of what could be in there. This is what one of my patients had to say about the practice of medicine. They just monitor my degeneration. I think that's a lousy way to practice. This guy must have had a sense of humor. He probably instructed this to be put on his gravestone. As a physician, that would be my nightmare, to have a patient tell me that he was sick and I missed it. So Here's how to save money. This is cost savings number one. Remember, I told you I was going to be blunt. I was going to be blunt. Fade fast, die quick. Now, I know that should be quickly, but die quick. Sounds better that way. So let me show you this survival curve. And this shows two ways to age. One is with integrative age management medicine, and the other is traditional medicine. And there are 4 F's, and let me show you where they come into play. The first F is the fun stage. That's 0 to about 48. Next is the function stage. That's where you can't do what you used to, but you can still get around. You can still park the car on the back 40 and walk in without being out of breath. But then you start to get frail from 60 to 77. Who wants to get frail after 60? That's just horrific. And then failure after the late 70s into ultimately death. So that's age management and traditional medicine. This is where traditional medicine will take you, and this is where age management will take you. And you will notice in comparing the two curves that you'd be a lot happier if you were having fun all the way out to 80. Wouldn't that be a concept? Let me show you. I'm not 80. These are my boys. We were at Arches National Park in Utah, which is already at altitude. And we climbed up to see Delicate Arch. It is the iconic view that is in so many of Utah's postcards and their tourist stuff. Let me tell you, the hike up to Delicate Arch is not easy. So if you're already frail, you're not going to make it. You'll never see it live. You'll always have to look at pictures because you will never have been fit enough to get there. So here's one definition of fitness. You have the time and energy to exercise. If you don't have the time or the energy to exercise, you may have a problem. Your hormones may be low. Now, this is how you want to go. It is called rectangularizing the survival curve. And what you do is you have fun, and then you fail. And when you fail fast. So if you do that, you miss all the extreme medical expenses that occur at the end of many people's lives. Accordingly, cost savings number 2, don't fade slow. Don't fade and then fade fast. Begin with the end in mind, Stephen H.R. Covey said in The 7 Habits of Highly Effective People. And I thought I would show this to you. I just want you to take this in. Humor me if as I read it to you. I take metformin for the diabetes caused by the hydrochlorothiazide I take for high blood pressure, which I got from the Ambien I take for insomnia caused by the Xanax that I take for anxiety and that I got from the Wellbutrin I take for chronic fatigue, which I got from the Lipitor I take because I have high cholesterol, because a healthy diet and exercise with regular chiropractic care and superior nutritional supplements are just too much trouble. And so many times, I don't see anything quite this bad, but so many times I see similar things where one medication causes a side effect, and so another medication is added to deal with that side effect, or maybe the first medication isn't working adequately, so we have to have another one that's about $2,000 a month to augment it, which I'll show you. I want you to keep this in mind. This is our U.S. American medical system. I was going through I think this was the Boise airport. Yes, it was. And I want to call your attention to what that sign says. It says less than half the sepsis mortality rate of the national average. Less than half. Is that 49%, 45%? And mortality, that's dead. So if I were a patient at Intermountain Medical Center and I was having surgery and I got infected, I'd have a little bit less odds than better than even that I would die. Almost even odds, less than half. That the way you want to live? Is that the expectation of your medical care? I would suggest we live in a way that we don't end up having to get surgery unless it's something totally outside of our control, like a car accident or whatever. So you really want to let yourself go to that point? Not me. At Mayo Clinic, where I trained, it was ground into me the needs of the patient come first. And that's what I like to look at when I am evaluating people as they're fading and beginning to show signs of depression. This is from the first webinar. I will be brief. This is the expensive, painful, and time-consuming way to get your antioxidant levels obtained. This is the fast way, 30 seconds, beam of light, instantaneous results, and not painful. And it absolutely works. The reason I'm going through this fast, rapidly here is because I've already shown it to you before, and you can always go back and look at it on SlideShare. So one single measurement on that Raman spectrometer is just as good as taking one reading every month for 6 months and then averaging it. This says that the use of the skin carotenoid status may effectively serve as an integrated biomarker of health. Isn't that interesting? What's an integrated biomarker? It means it kind of integrates, it takes everything in that's underneath it. So it's an integrated biomarker, a biomarker of health. So back in February 2017, when I gave a lecture the first time on oxidative stress, antioxidant carotenoid, with all of these conditions, I looked at the number of citations. So as you can imagine, 2017 is not good enough data for me to show you, ladies and gentlemen. So here it is as of 5/16/2020. I'm going to go back and forth just a little bit. So Alzheimer's disease, 8,656 citations currently. Back then it was 6,820. Imagine that. Cancer general, it was 20,680 back in February of 2017. Now it's 26,865. So I would suggest that you go back and forth and back and forth. Let's look at rheumatoid arthritis. Rheumatoid arthritis, back in 2017, there were 688 citations associating with rheumatoid arthritis and oxidative stress. Now there are 933. That's almost a 50% jump. So the literature is progressing. By the way, PubMed now has a dandy new interface. I was just on it today. It's pretty slick. Again, in terms of not contracting something that is going to be really devastating, I thought, what's the condition? One of the conditions that women fear the most, that's breast cancer. So this was a pooled analysis of 8 cohort studies, which included 80% of the world's peer-reviewed, published prospective data on plasma, serum carotenoids, and breast cancer. It was about a 1-to-1 match. The conclusions showed, I'm going to show you the conclusions first, and then I'm going to show you the data. The conclusion showed that the comprehensive prospective analysis showed that women with higher circulating levels of all of these carotenoids may be at a reduced risk of breast cancer. Now, keep in mind, this is mealy-mouthed, academic. We got to kind of tone it down so we can get it peer-reviewed and published method of putting it out. May be at reduced risk of breast cancer. Well, that's all you can say. But, I mean, if I were a woman and I was concerned about breast cancer and I saw what I'm about to show you, I would be on my antioxidants and carotenoids. So this looks very difficult, but it's not, I promise. This is a relative rate of 1 that is set arbitrarily. At the bottom, you can see 0.8 and 1.2. 0.8 means you got a 20% less chance of having breast cancer, and 1.2 means you got a 20% more chance of having breast cancer. Here are all of the different antioxidants and carotenoids that were looked at. Here's the total carotenoids. And you can see on the total carotenoids, there are 5 levels. It was the top quintile, second quintile, third quintile, fourth quintile, and finally the flunkers at the bottom of the class, the bottom 20%. And when you look at the flunkers, the bottom 20% of the class with low carotenoids, because they're not eating their fruits and vegetables like their mamas taught them, which we covered in webinar 1, when you look at them, they've got 20% less risk of breast cancer. 20%. Now, where do you want your carotenoid level to be? If I were a woman, I'd want it in the top quintile. Did I say that right? Let me look at that. Sorry. All right, I beg your pardon. So in the red square, if you look at the top line, that's the bottom quintile. The bottom line with a little circle around it, that is the top quintile. So the top quintile of carotenoids. So that's where you have the 20% reduced risk. 20%, my goodness. And not only for breast cancer, but if you get human papillomavirus, it's the main thing that causes cervical cancer. And there is a 50% increased risk in women who have low dietary carotenoid status. 50% increase. I would want to be eating my fruits and veggies or taking multivitamins. Okay, this one I showed you before. I'm not going to belabor it. This is on webinar 1. This is one of my favorite studies, the Akbarali-EVA Epidemiology of Vascular Aging Study. If you look for Akbarali and EVA and put it on PubMed, last time I checked, it's 5 down from the top, and you can see this study. Here's the study, about 1,400 people. The take-home message was if you are a guy in the lowest quintile, then your risk of dying from anything was 2.94 times greater than if you weren't. And your risk of cancer was almost double if you're in the lowest quintile. And the conclusion was total plasma carotenoid levels were independently associated with mortality risk in men. Now, how many ways do I have to show this to you? The literature really speaks pretty much with one voice. You will not find citations that say, well, we studied lots of people that had solid total plasma carotenoids or skin carotenoids, and they had cancer and they dropped dead. It's just not published. You usually see a positive effect. But then Akbarali and colleagues went one more. They looked at how the brains perform. So this is plasma carotenoid levels and cognitive performance in the elderly. And before I go on, let me pause. Most of the healthcare expenditures are in about the last year of life. And certainly they go up as we age. Why? Because some of us lose our minds. My mother, for example, who died most likely of Alzheimer's dementia. I say most likely because the only way to definitively diagnose it is with a brain biopsy at autopsy, and she did not have that. But she had all the signs of Alzheimer's, and she ended up totally demented. Couldn't even feed herself, couldn't talk, couldn't communicate. It's not a good way to go. And if your family is paying for your care, it will eat up a lot of data, a lot of dough. It could bankrupt you and your family. So again, this is the plasma carotenoid levels and cognitive performance. The conclusions were not only that it'll keep that it will lower your risk of all-cause mortality if you're a guy, but that low carotenoid levels could play a role in cognitive impairment. Again, eat your fruits and veggies. Now this was fun. This was a search from this morning. It was carotenoids and cognitive performance. There are 143 citations. I call your attention to this graph, which shows that there is a steadily increasing rise of studies. It looks like there's a drop off in the studies, but that's because we've only had 5 months in 2020 so far. Top 3, I mean, just the top 3. I took them as they came. So here they are. A high consumption of vegetables, fish, and seafood, legumes, eggs, and fruit is associated with a higher intake of lutein and zeaxanthin and greater word recall among older adults. Here's another one. 10 milligrams of lutein per day for 12 months leads to improvement of cognitive functions. And finally, this one caught my attention. Daily avocado intake for over 12 weeks improved attentional inhibition. That's daily. That means one of those green, tough on the outside, I don't even know, fruit, veggie, the thing I get at the grocery store, the avocado, goes into guacamole, which I love. One of those per day. That's more than most people eat in terms of avocados. Improved attentional inhibition. And interestingly, the cognitive benefits on this one were independent of lutein concentration. So lots of evidence about cognition and antioxidants. I love this poem from Dylan Thomas. Do not go gentle into that good night. Old age should burn and rave at close of day. Rage, rage against the dying of the light. And it goes on and on, multiple stanzas. But essentially, he's saying, fight it. You know, stay as vital and as well as you possibly can and luxuriate and enjoy the life you've been given, because it's going to be the only one you'll have. I talked to you about this last week in the do-it-to-yourself treatment of depression at home. We took note of the fact that the Japanese iodine intake is much bigger than ours. It's 1,000 to 3,000 microgram per day, which is about 10 times as much, 10 to 20 times. And we talked about these statistics. Again, I'm going through briskly because we've covered it. This is a review. I put this in. So when you look at the Japanese health statistics to US health statistics, we have a 2.62 times higher increased risk of breast cancer mortality, 10-fold increased risk of prostate cancer, 1.6 risk of heart disease, and 2.4 times higher risk in infants. Now, one criticism of this has been, well, you're only measuring one thing, that's iodine. The Japanese are more slender than Americans, and they eat more fish, and they walk around more, and that is all true, and that could impact it. But I'm very impressed with the significantly different amount of iodine that they have. And this one I showed you before. This is the Bruce Ames study that talks about how low micronutrients can really mess you up. That's the bottom line of the study. It can really mess you up. You may be able to walk around, run from the saber-toothed tiger and so forth, and not realize that you're sick, but you won't be repairing your DNA or building for the future. So, how not to fade. This is a relatively new study. I just came across it on one of my social media accounts. It's not social media. It's complementary and alternative medicine. This is a published journal article. It's the JAMA, Journal of the American Medical Association Network, open journal. It was a study of 252 patients ages 18 years or older. About 1,600 were treated at the Functional Medicine Center, and almost 5,000 were treated at the conventional medical clinic. And they looked at their primary endpoint, in other words, where they were going to count it, was the change in standard deviation in functional medicine versus conventional practice. Now, a 1.59 standard deviation is really impressive. That's like if you're in school and you've made a 50%, you failed it miserably on a test. 50%, right? That's the median, because you got 0 and you got 100. So 50 is right in the middle. If you raise that score from an F to a 78 or 79, you pass. That is a 1.59 standard deviation improvement. Whereas going to conventional practice, if you make a failure on the test, 50, and you have a 0.33 standard deviation, that's probably 68, 60, you still fail. You fail. There's a huge difference between 1.59 standard deviation and 0.33 standard deviation. And so the conclusion was, in this study, the functional medicine model of care demonstrated beneficial and sustainable associations with patient report, and that stands for health-related quality of life. That was the scale that they used. In other words, functional medicine works. So now let's get real. What's it to you? So you're saying, well, you've been talking about all the cost of society and so forth, and 3.5 trillion, but what's going to come out of my pocket? So the first section is medical misery. So if you're obese and overweight because you're eating pizza and drinking Red Bull and can't push away from the table and are not trying, you can be on any number of blood pressure medications. Bystolic has been extremely expensive. It's $150. It's $40 to $80 with copays, and some would say it's arguably better than the first two that are cheap. High cholesterol. I mean, if you have high cholesterol, that's treated pretty inexpensively. High blood sugars. This is where it gets really spendy. So metformin, that's cheap. Toujeo, which is a insulin or a shot that you, let's see, it is a medication that you take for the control of blood sugar. Humalog, that's instant release insulin. Eli Lilly makes it, and Lantus is a long acting. And Lewis, who you will see down there at the bottom, Lewis Kivett, was telling me that some people, I don't treat diabetes, so I'm not exactly sure which of these it is, but some people end up having to come in and get 5 to 6 boxes of needles. So if it's Humalog, let's just think about that. That is $3,000, and that is per month. And if your insurance doesn't pay it, you either pay it yourself or you don't get it. One of the things that I have experienced with my patients is they tell me, well, my insurance stopped paying for my XYZ insulin, and now I had to change it, and now my blood sugars aren't under as good a control. COPD, this is where you smoke your lungs out because you won't put the cancer sticks down. So Advair single source, the real cost is $250 for 30 days. With copays, it's less than $50. Spiriva, Respimat, and Brio are the new expensive ones, but about $500 a month if you don't have insurance, or if you do have insurance, but you got a $15,000 deductible. So everything that you pay at the lab, everything you pay at the doctor, everything you pay at the drugstore, it's going to come out of your high till you hit $15,000. And then there's degenerative joint disease, osteo, because you've ground your knees to dust, and that's pretty cheap to treat. Well, so that's medical miseries. What's the alternative? You're well. You have normal weight. You have no hypertension, no high lipids, no high blood sugars, and you haven't smoked out your lungs. Guess what you're paying per month for medication? $0. That's a big cost savings. So that's medical. Now you say, yeah, but I hear you take care of those mental patients. Well, that is true. So psychiatric miseries, depression, that's a big one. Vibrant and Trintellix are two outstanding, fortunately, they're branded. I say fortunately because the company's invested a lot of money to come out with these. They are unlike anything else on the market. They are also extremely expensive. I had a patient in her 60s. She was doing really well on her Vibrant. Her insurance was paying it. Then her company decided to cheap out on their insurance, and suddenly the insurance coverage wasn't as good. And now she's having to pay for $300 out of her pocket until her $10,000 to $15,000 deductible kicks in. You get the idea. Now, I have seen this one advertised a lot on TV lately. Rexulti for the treatment of resistant depression, whatever that is. I think what it means is you tried an antidepressant and didn't think about the patient medically or systemically, and so that didn't work, so you're going to put something else on top of it. $1,300 to $1,400 a month if you have to pay for that out of pocket, and with copays it varies. High blood sugars, because If you're depressed and you're eating and you're gaining weight, you're going to have blood sugar issues. And then let's look down at the bottom. You're well, you're normal, you're not depressed, you're on no psych meds, no medications related to obesity, but you need HRT, hormone replacement therapy. What's that going to cost you? Well, if you're a woman, you're going to need estradiol and progesterone. Now, there are different ways to do this. Generally, if you're doing it within a decade of cessation of menses, oral is safe, but it's something that has to be looked at. So the oral estradiol will cost you 10 to 15 bucks a month. Progesterone will cost you about 20, and you're done. 35 bucks per month. You're set. Whole lot better than a $400 medication and then a $1,400 medication on top of that because you have resistant depression. I'll show you how to work it up, or how it should be worked up. The next one is needs HRT, clomiphene. This is for guys. It's used for two different purposes. One is in women that are trying to get pregnant and going through in vitro fertilization. And by taking clomiphene, it causes a stimulation of their ovaries so that the ovaries pop out more eggs. They can be scooped up by the in vitro fertilization specialist and fertilized in the petri dish and then reinserted. So that's how it works in women. In guys, the testicles are the same thing, believe it or not, as the ovaries in the women. Because when a guy is in utero in his mama's belly, the testicles start up in the abdomen and they migrate down, and then they come out, they descend, and they fill up the testicular sac. So embryologically, it's the same deal, and darn if clomiphene doesn't work the same way. Except in a guy, it doesn't mean that they're going to be popping off more eggs because we don't have those, but it means that the testicles are going to be making more testosterone and also more sperm if people are trying to get pregnant. So the real cost, if you just look at any old place, $100 to $186, but right down the street, we've got, and this is for 60 of them, 60 per month, 50 bucks from Optimum Wellness, 25 bucks if you just need 30. And I got lots of patients that just need 30. So 25 bucks, pretty cheap. It's the cheapest deal going for hormone replacement therapy in guys, and it does not shrink the testicles. The other thing I will tell you is this is an example of off-label prescribing. I'm not saying you have to go get it. I'm not telling you to go get it. But off-label prescribing is where a physician will prescribe a medication for you that you cannot read that indication in the PDR. And believe me, if you look in the PDR, clomiphene will say it's for infertile pregnant women, and the technical stuff will say who basically we need to harvest more eggs. That's how it works. You won't say anything about male hypogonadism, which is low testicular function. But if you go to pubmed.gov, you type in clomiphene male hypogonadism, you will see citation after citation after citation. It says, these guys had low testosterone, we gave them clomiphene, their testosterone went up. These guys had low sperm count, we gave them clomiphene, and their sperm count went up. These guys couldn't get their wives pregnant, we gave them clomiphene, they got their wives pregnant. I mean, every study that is published, and there are a bunch of them, I have not seen one that says, yeah, these guys had low testosterone, we gave them clomiphene, and it didn't work. I haven't seen negative studies. So it's a pretty cool deal. And it's really cheap compared to the big pharma stuff. And then low thyroid, I mean, that's a slam dunk. This is NP thyroid. And I think this is going to be oh, yes, it is. It's 120 milligrams. Sorry, there's a missing two there. Or 60, I beg your pardon. 60 to 120 milligrams. So that's either a regular size or double the regular size. And you will see that it's the real cost is up to $50. I don't know what that is, sorry. And when you get goodrx.com, what is goodrx.com anyway? If you get it through goodrx.com, it's only $15 to $25. Well, let's look at goodrx.com. This is the goodrx.com website right there, goodrx.com. And you can see right in the middle, you type in your drug name and then you find the lowest price, goodrx.com. Here's the classic downward slide that I see for a number of patients that come staggering across our threshold here at CWI. A 45-year-old woman who is unknowingly premenopausal. I say unknowingly because she's still having periods. That doesn't mean that you're not premenopausal. It just means that your periods haven't stopped. So hormones are going down, still cycling, still having periods, kind of unknowingly premenopausal. The hormones fade insidiously. Her estradiol drops. Then what happens? Then you have decreased MAOI function, monoamine oxidase inhibition. Estradiol is the body's own natural monoamine oxidase inhibitor. And by the way, MAOIs are the bomb, literally, for the treatment of depression. There is no stronger medication than a monoamine oxidase inhibitor. But in a woman, the estradiol is not it doesn't have that level of MAOI function, but it does slow the breakdown of neurotransmitters. So when that's uncovered and MAOI or MAO starts chewing through neurotransmitters in the brain like a bunch of little Pac-Men on steroids, then you get depression, lack of focus, irritability, and you can get decreased libido as well from estrogen. So what happens with this 45-year-old woman who comes in, hopefully not to your family doctor, but to a family doctor, and she says, "Doc, I feel depressed, I'm not sleeping, and I don't know what's the matter with me." And he says, or she says, "Oh, well, you must be depressed. Let me prescribe an SSRI." By the way, in neurolinguistic programming, that's called nominalization. It means you name something. Person comes in and says, "I've got all these things," and you as a physician say, that means you are such and such. And that's dangerous. The only thing that can objectively be said is the patient meets some or all of the criteria for depression, but you really don't know yet. So what happens after the family doc or the nurse practitioner or PA starts an SSRI? Well, a lot of them will make you fat. So then you get fatter. And most women get depressed about that. Depression worsens. It's certainly not getting better. Weight gain worsens. Then you get metabolic syndrome because your pancreas is secreting so much insulin that your insulin receptors are getting resistant. And so it takes more and more and more, and that gets you fatter and fatter and fatter. And then if that keeps going, then you get AODM, adult onset diabetes mellitus. In other words, you're not born with it. You weren't born with the need for injecting insulin, but you end up with high blood sugars because your system is so far out of whack. And then you need medicine for high sugars. And then you need medicine for high lipids. And then now your SSRI needs augmenting because it wasn't working right to begin with. And so now you add Rexulti for about $2,000 a month. And then the weight gain gets even worse because Rexulti in some patients will make them gain weight. Does this sound like your idea of a good time? My word. Poor woman walked into her family medicine doctor or nurse practitioner's office and said, "I've got these symptoms and I'm feeling depressed," and she was starting on SSRI, and then it just goes steadily downhill from there. And we see this all the time. Oh, forgot. Now the patient has gained so much weight that she has obstructive sleep apnea, which is where you choke off and gas and stop breathing, or upper airway resistance syndrome, which is where you're breathing against resistance and it fragments your sleep and keeps you from having a restful night's sleep. And now you need a sleep study for $3,000. And then if you're diagnosed with OSA or upper airway resistance syndrome because of your obesity and your girth, now you need a CPAP or BiPAP, which is going to run you another $2,000. Now, I'm not saying this happens all the time, but I have seen things like this over and over and over. So I know it may seem extreme. Trust me, we see it. And if you know what you're looking for, you will see it. Now, this is what I would suggest to be a more reasonable approach. The 45-year-old woman, again, comes in. She's unknowingly premenopausal. The integrative physician or healthcare practitioner knows hormones fade insidiously before the period stops. Estradiol drops, we went over that. So here's the integrated medicine treatment. First, get the facts. Check all the hormones, including thyroid hormone, all 4 of the good ones, the ones that we really need to see the entire axis, which I talked about in the webinar last week. The sex hormones, that's like estradiol and testosterone. The adrenal hormones, that's like DHEA, sulfate, and cortisol. We need to check the CBC because, frankly, some of these women can be anemic. Remember, women bleed. And if they don't eat enough red meat, if they decide they're going to be vegetarians and never touch a cow again or beef, they will frequently end up anemic. I have had probably 4 or 5 patients that I have sent to the hematologist for IV iron infusions. They were so low in iron. And you'll never know that unless you start checking the CBC. Then there's the comprehensive metabolic panel, where we can see what your blood sugar is, your liver functions, your electrolytes, and your kidney functions. If needed, we'll check all the glycemic indices like your fasting insulin. We've already got the fasting sugar from the CMP, maybe a hemoglobin A1C, and we'll check lipids. And with that, we'll probably have a good idea of what's wrong and how to fix it. So here's what you do. You find out what is out of order and you fix it. Instead of, oh, you must be depressed, have an SSRI. Now, just to give equal time to our male friends, I've got 2 really quick cases. Male 1, the case of the mismanaged executive. This is the summary. I use this slide every time I give my bioidentical hormone replacement therapy 16-hour course. He was a 42-year-old male. He was a CEO, had a background in psychology. He was extremely stressed, and he had ADHD. So ADHD, extremely stressed, background in psychology, my kind of patient. He said, I'm so tired, I feel like I'm dying. And he was depressed. So I got labs instead of just reflexively sticking him on an antidepressant. And I found he had low testosterone despite multiple pumps daily of a low potency FDA approved big pharma transdermal testosterone gel managed by his endocrinologist. I'll just let that sink in. By the way, I'll tell you that the big pharma testosterone gels will run you about $400 to $500 a month. Some insurances won't pay for them. And when you hit 65, where you would be having fading levels of testosterone, Medicare will only pay for androgel, which is probably the crappiest of all of them. And this man not only had low testosterone, he had low thyroid and low DHEA sulfate. So his treatment was testosterone, cypionate intramuscular, that's the shot in the butt technique, DHEA and Armour thyroid, and in 3 to 4 weeks, he was well, and no antidepressants were used. So it's not just women that get hormonal or begin to lose their hormones around the time of menopause, but it's also guys. Here's male number 2. This man is in here for a reason that I will show you in a moment. He came into my practice in March 2018. He was at that time a 38-year-old business owner. He had had salivary hormone testing done, and his testosterone level had been low. He's a big believer in health food and nutritional supplements, so he tried those, and none of them worked. I ordered his labs. They were in the bottom tertile, which means the bottom third of the class. So if it's on a normal distribution, that means you would not pass. You'd be at like the 25th or 30th percentile. It's in the lowest tertile. We started him on clomiphene. It didn't work. Then I put him on testosterone, 100 milligram per day, and a treatise-based compounded and supplied scrotally. And that is peer-reviewed. He's basically been stable for 2 years. Guess who I saw this afternoon a mere few hours before this webinar? I saw this guy today. Of his testosterone, he said, it's been a life changer. I didn't realize how bad I had been feeling until I started to feel better. I would never have been able to maintain the work I'm doing unless I had the proper testosterone levels. And I asked him if I could share this. He said, absolutely. So it's a pay me now or pay me later situation in terms of cost savings. One thing I would suggest is lose weight. So if you're a 20-year-old and you go from obese to overweight, you save $17,655 in direct medical costs and productivity losses during your lifetime. Now, this is not necessarily out of your pocket, but it's the total cost reduction. If you go from obese to normal, you save $28,000. If you're older, you save even more. Obese to overweight, $18,000. Obese to normal, $31,000. Wouldn't it be cool if for all of our obese patients in the population, we could meet them at their point of need, look at their hormones, treat them compassionately, and not shame them or body shame them or tell what some of my female patients have told me that my doctor just said, push away from the table and exercise more. I mean, that is not going to cut it. If it would have worked, they would have tried it. So this is what's actually coming out of your pocket. So here are the households with employer coverage and how much they spend. The higher paying households spend $8,000 in employee premium contributions, and the out-of-pocket cost for the high spenders, $5,000. This is 2016 to 2017. Here's another way to look at it. 23.6 million Americans have employer coverage, and they spend a large share of their income on premiums or out-of-pocket costs or both. So here's the high premium contributions relative to income, and about 11.6% of the 17.4 million people had high premium contributions relative to income. In other words, it was hurting them in their budget. 6.2 million had high out-of-pocket cost relative to income. This is copays, insurance won't pay for things, and these households spent 10% or more of their income on out-of-pocket cost. And then there were 4.1 million people that were in both. I mean, that's a world of financial misery right there. And I have news for you. Insurance is not going to get cheaper, and coverage will probably get worse. Here's another one. This is from Health Affairs blog, and this looked at the healthcare cost burden, I beg your pardon. And if you see right here in the tri-state, well, in Indiana, our growth in terms of the cost burden has been 25 to 30%. And if you go and look down at our friends in Kentucky right here, it's gone up greater than 30%. When you compare 2010 to 2016, here's the percentage of people that have a deductible that they have to pay, 77.5. Now it's gone up about 10%. The amount of the average deductible that people had to pay, it used to be about $2,000. Now it's about $3,000. That's a 50% increase in 4 years. 50%, 4 years. Here's the premiums for the family. They've gone up about 30%. And here's the cost burden increase. It's gone up a little bit from 28 to 30%. This suggests that in some cases, premium increases may have swamped new income, driving up the cost burden. So it's always cool to be able to quote yourself. So this is one of my quotes. Eligibility without affordability and accessibility is not true health reform. I don't care how many people are eligible for health care. I want to know if the health care that they've got is affordable and there are providers that will take it that are accessible, because you got to have all three, ladies and gentlemen. So used to, in Evansville, Indiana, I would talk about the casino Astar odds on things. Now we've got Tropicana. So I'll tell you the Tropicana odds on morbidity. Here we go for smoking. Smoking causes 1 in 5 deaths in the U.S., 480,000 deaths annually, and 279,000 deaths in men. If you smoke, you have 23 times increased risk of death from cancer of trachea, lung, and bronchus. 23 times. And you have a 4 times increased risk of dying from heart disease. Now, just to be ridiculous, I have this glass of water right here. Been sipping it a bit. Let's say that there was a drink that you could put in a glass, and if you drank that drink, it would increase your risk of death by 23 times. Would you drink that drink? Would you sip it? That's what tobacco does. 4-fold increased risk of dying from heart disease. Women, like Virginia Slims used to say, you've come a long way, baby. More women are now dying of cancer of the trachea, lung, and bronchus, and smoking increases your risk 12-fold. Here are simple things that you can do. Become aware of what's possible. There are other things besides saying, thank you, I'll be happy to take the SSRI when the physician gives you the prescription or he prescribes it. Stop accepting that you can't be totally well. Back in 1946, the World Health Organization said they defined wellness as a thriving situation, not merely the absence of disease. Now, if you have had some terrible traumatic biomechanical damage, you've popped a disc in your back from lifting, or you've got compound fractures, or your joints are wearing out because of rheumatoid arthritis, I don't think you can be totally well, but you can be a lot more well than you are. Stop accepting that it's not my fault. It's not my fault I'm depressed. It's not my fault that I'm getting fatter. It's not my fault that I have no air in my lungs because I won't put down the cancer sticks. Stop accepting that. Maybe it is your fault, or at least partially your fault. I'll make a deal with you. Let's share the responsibility. Partially it's your fault, and partially it's the medical care establishment's fault that they haven't identified what truly is the matter. So it's shared responsibility. But don't keep saying it's not my fault. I love what Harvey McKay from Minnesota used to say. This was from his book, Swim with the Sharks Without Being Eaten Alive. And Harvey says we could all use a little coaching. He talks about all the star athletes, they've got coaches. There are quarterback coaches. There are defensive coaches. There are golf coaches. Harvey has a golf coach. He has a Chinese coach, and he has a speech coach, among others. And he uses all of them. The time I heard him speak in Minneapolis in 1995, his speech coach was in the audience taking notes and was going to critique him later. So coaching. And there are NLP techniques that are done in a coaching way that can result in sometimes instantaneous change. I love what Jim Rohn said. Success is a few good disciplines practiced each day. And Mr. Rohn also said failure is a few errors in judgment repeated each day. So in terms of saving money for your healthcare, you can practice a few good disciplines, or you can continue to make a few errors in judgment. And they don't seem that much at the time, but over the course of your life, they will compound. And finally, don't be a sucker at your doctors or the pharmacy. So don't be a sucker in terms of your medication. If your doctor gives you a prescription and calls it in someplace, see what it is on goodrx.com, price it out. In fact, you might want to do that first and then ask for it. Don't be a sucker. Use that. I get no money from goodrx.com. It doesn't pay me. I just love it for what it does for my patients. Here's a few examples on cost savings. So when I looked up rosuvastatin, which is the generic for Crestor, At Meyer Pharmacy here in town, it's $247 for 30 generic 5 milligram tablets. Well, when you print out the goodrx.com coupon for Meyer, lo and behold, it's $11.06. Ladies and gentlemen, that is a 20-fold reduction in price for going to goodrx.com and printing out the coupon. You say, well, that's pretty good, but I can do you one better. So let's say you go to Walmart with a 20 milligram tablet, goodrx.com price, and what you need, the desired dose is 5 milligrams. If you can get your doctor to write you a 20 milligram tablet, and it like one every night, or as directed, the doctor says take a quarter at night, one prescription lasts 4 months. And suddenly your 30 doses that would cost you $247 if you were acting stupid and not checking goodrx.com will be reduced to $2.11 per month. And that is a 100-fold reduction in price. Vibrid, I was going to talk about samples. So Vibrid is a branded antidepressant. It's a really good one. I like it. It's not my favorite, but I like it. I have a number of people on it. If you get 30 20 milligram pills, which is the middle of the road dosing, it costs you $300. And some of my patients, their insurance will not pay for it, or they've got high deductible. So I prescribe 20 milligrams and tell them to take a quarter of it. And I've got these, they're 2-week starter packs for Vibrid. But when you take a 20 milligram and you quarter it, for each one of those weekly starter packs, it's a month. So I can keep people supplied with samples. I keep people supplied with Latuda samples. I keep people supplied with Trintellix samples. So if you are a patient, ask for samples. And the other thing I will caution you about is don't accept with blind faith a prescription from your healthcare practitioner. Oh, I think this will help you. Here's a 1-month supply. Come back and see me. Well, I mean, if it was be Vibrid, for example, to be ridiculous, that's $300. And let's say your insurance doesn't pay for it. So you're standing there at the pharmacy with your prescription. You know, am I going to do it? Am I not going to do it? Am I going to do it? Am I not going to do it? And so you get it for $300 and you take it home and you take the first pill and you puke your guts out. And you say, I can't take this stuff. You bought a month at $300 and you can't take the medication. So it's always a good idea to start with samples. You say, well, but my doctor doesn't have samples, or my nurse practitioner doesn't have samples, or the clinic doesn't let my doctor have samples. Well, that's too bad. I mean, there are other doctors out there that have samples, and there's a whole school of thought about this. Some of the do-gooders that are trying to police the industry say, oh, physicians should never receive samples because it will corrupt them and it will cause them to want to prescribe more of that. Not true. I will prescribe whatever the patient needs. So, and some hospitals say you can't get samples, you can't have samples, you can't ask for samples. The pharmaceutical reps can't see you. I love pharmaceutical reps. Pharmaceutical reps make my patients' lives better because I get free medication for them. What is not to like about that? I have saved, thinking about one patient, $2,000 a month on her Latuda. And that, ladies and gentlemen, is $24,000 a year. I have given that woman the cost of a really good car from the pharmaceutical samples that I've got. So I suggest to my colleagues that they don't be goody two-shoes about it. I close with 2 quotes. Arnold Schwarzenegger said, "The mind is the limit. As long as the mind can envision the fact that you can do something, you can do it. As long as you really believe 100%. So I want you to think about your commitment to saving money on your health care. And finally, I close with this Mayo brother. For me, the practice of medicine has opened the door to the greatest adventure in life. Medicine is like a hallway lined with doors, each door opening into a different room and each room opening into another hallway, again lined with doors. Medicine is always wonderful, and never will be finished. So that has been my experience, my adventure, my joy in my medical career thus far. It's always interesting. There's always something opening up. There's a new hallway that I can go down and explore. I didn't know much at all about bioidentical hormone replacement therapy over a decade ago. Now I do. I didn't know about functional medicine testing. Now I do. And I'm not saying that because I'm so great. I mean, anybody can learn it if they're a physician or a healthcare practitioner and actually dedicate themselves to it. And the cool thing about it is the more you know, the more you can do for people. So thank you for coming. There's my email there. If you want to write me, ask me a question, say, I like this, I didn't like that, please do so. And there's my office number right there. So thank you for attending. I'm going to stop my screen share and I'm going to bring the beautiful ladies back on screen that you can't see right now. There's one of the beautiful ladies.
Wow. I am so glad, Dr. Cady, that we do not have to write so fast that to try and make all those notes from all that great information and that knowledge you've shared and that you've got it on SlideShare.
It's going to be. I will put it on SlideShare before I leave the office tonight.
But there were still lots of notes. Pay me now or pay me later. Mm-hmm. Isn't that just the truth?
Yes, truly is.
Another one is, how do you want to go? and it's got to be that fun, and extension of fun. I bet there are very few people on this call right now. I know a number of them who would disagree with you. So I think that is something we can, all the way to fade fast. Mm-hmm. I think that's one of the credos that you've used before for the number of years that we've known each other. Yeah. And I think that is something that is saleable. Yep. For sure. Yep. So we do have a question. We've got a couple actually. So let me just check here.
Great.
That was great.
Thank you. It was fun. I enjoyed the material.
Hey, yeah, I did too. And so we have some people saying hi. So
Here we go. Now I see chat. All right. So thank you. I was going to ask a question about dementia, but I forgot what it was. Just kidding. My mother had dementia. The doctor said there was nothing they could do to slow it down. I don't always listen to know. So I looked into natural ways. I found a good ginkgo biloba, coconut oil peels, vitamin E, DHA and melatonin. I also got her playing card games online. She lasted 3 more years than any doctor said she would. She seemed to stop forgetting as much as she was before I started my plan. I'm just going to keep reading this. This is worthwhile. My question is, now that I had the long intro, do you really think this helped, or did I just think it made it better? I'm going to pause. Yes, I'm almost sure it helped. And I will quote you a couple of references. One is one of my mentors, a guy named Dale, well, actually not a mentor, he's an intellectual mentor of mine. I've read his book, Dale Bredesen, who talks about the end of Alzheimer's. I have another mentor that I do know, who's a friend, Daniel Amen, who wrote a book called How to Prevent Alzheimer's. And all of these things that you were doing are totally on target. So in Bredesen's book, about 1/5 of the way into it, on 3 different pages. So it's a page on the left, a full page on the right, and another page on the back side, if memory serves. He lists all the characteristics of an ideal Alzheimer's drug. And one of the characteristics is it would have powerful antioxidant function, and that's vitamin E. And it would have medium chain triglycerides, and that's the coconut oil. And ginkgo biloba has actually been published to work in opening up vasculature in lower extremities, and it is thought to improve cognition in people with dementia. And there's all kinds of other things that could be done, including a low-carb keto diet, Also, my aunt, her sister, is going down the same road. Should I start this with her? And is there anything else I could use? Yes. So my third reference to you is a book by my friend and pint-sized troublemaker, the remarkable Amy Berger, all of 5 foot tall, that put down a physician, the best I've ever seen a physician taken down in a Q&A at her talk, which, by the way, was the only talk in 3 days in Nashville, Tennessee that was not given by an MD or a PhD. And Amy took note of the fact that her mother was fated with Alzheimer's disease, and Amy didn't know what to do about it. And she ultimately came to Dale Bredesen's book and found it and said, this guy is making a lot of sense. And so she began studying the keto diet and how when you burn ketones in the brain, the mitochondria just gobble them up like, popcorn. It just loves it. It's easy for them to digest. Whereas glucose, when it gets up into the brain, has to be admitted to the cells via the insulin receptor getting activated. And so you can get brains that are insulin resistant. And so if you go out and Google type 3 diabetes, not type 2, type 3. So type 1 is juvenile onset. Type 2 is adult onset. Type 3 is insulin resistance in the brain. And if you read the book, I think she makes a very compelling case. I can tell you anecdotally that patients that I have put on a keto diet, they lose weight, they feel sharper, and they have actually tested better on a cognitive test that I've given them, which reminds me, Elizabeth, let me throw this open to everybody out here. On our new redesigned website, which is cadywellness.com, if you go all the way down to the bottom, there is a little do-it-to-yourself cognitive test that you can take, and it will score you on the bell curve. And so you can see how you compare with the population. And, if you don't like the numbers, then there are things that you can do about it. And if you do, then congratulations. But it's a fun way. No obligation. You don't have to put in your email. I'm not going to scam you and start sending you circulars. It's fun. It's available. So I hope that answers all of those questions. And then, well, this is from one of my friends who is a very thoughtful lady, but I'm not exactly sure what it means. And she says, the self-examined life, ... I'm going to think that that probably means that what she got out of this was how to examine your life and the benefits of a self-examined life. Thanks so much. What was the name of the book? The first book was The End of Alzheimer's by Bredesen, Bredesen. The second book is How to Avoid Alzheimer's by Daniel Amen, A-M-E-N, like amen at the end of a hymn, which is how he pronounces it, amen. The third book was The Alzheimer's Antidote. And the cool thing about the Alzheimer's Antidote is it's not just about Alzheimer's. It does take its kickoff from the fact that her mother died of Alzheimer's, but Amy really does a very good job in the book in correlating the glucose load in the brain with causing neuronal destruction, and conversely how the ketones, when they are burned in the brain like little munchies at the mitochondrial level, are easily burned and they improve the brain, and so the neurons don't shrink back. But whether or not you're doing it for cognitive preservation, or you just want to lose some weight and be healthy or drop your lipids, it's a very good book. Which reminds me of a story. Robert Atkins wrote the book, I think it was The Atkins Revolution, and the American Medical Association pilloried him throughout his life, and they said, He was going to kill people with his foolish diet, and it was sick, and there was no scientific basis. And how in the world could eating fat lower your risk of heart disease? And then one day he slipped and fell and hit his head, and he died. And after he died, the American Medical Association said, well, looks like he was right. So unfortunately, he didn't get the validation during his lifetime. But he was the first one that really started talking about high fat, high protein. I don't necessarily think you have to be eating fat all the time, but I will tell you, avocados are really good. I'm on the keto diet most of the time. Eat avocados, veggies, filet, you know, all that's on the keto diet. You can go to, I don't know if you have it where you live, but we have these places called B-dubs, Buffalo Wild Wings, BWW, so B-dubs. And you can go to B-dubs and you can get a great hamburger. So, and you can do it keto style. You just say, hamburger, hold the bun, no French fries, bring me some coleslaw. And it's a keto. It's remarkably easy to do. You will go into carb craving and withdrawal for about the first week. All right. So Ms. Aman said, we cannot ignore, I think this is, we cannot ignore examining ourselves as we age. And I totally agree. Elizabeth, are you seeing any other questions up that we need to address?
I am not at this time. And Ms. Aman, I'm with you. The unexamined life is not worth living. And I teach courses on that to new entrepreneurs, actually, because it starts with self-awareness. So yes, I'm totally into that.
Okay.
A little late, but definitely there is no such thing as being late, right? But no, I think that was it. And we can certainly, I'm in touch with Joe tomorrow, actually. I have a meeting with him. And so I make sure that he has the names of those books as well. So
okay, very good.
All right.
So
well,
thank you everybody for coming and attending. It was great. I thoroughly enjoyed presenting it to you. And next week, I'm going to polish my crystal ball and tell you what's coming next.
That would be great. I put my hand up for the keto diet. So we'll just, if you also want that, just put that into the chat, or you can send messages to Dr. Cady and give him feedback on ideas for that, that you'd like to have him discuss. So thank you very much, everybody, and we'll see you next week. Thank you, Dr. Cady.
Thanks, everybody. Good night.
Everybody.